Hello, my name is Rehan and I'm going to be presenting case study on congestive heart failure. Patient is 58-year-old male presenting with rapid surge in weight and shortness of breath. He complains of swelling in his legs, complemented by small streaks of blood as he coughs. Based on his history, he was diagnosed with a host of conditions, including hypertension, type 2 diabetes, and CAD. To this end, he underwent coronary bypass grafting, seeking to manage the blockage caused by CAD. The operation relieved some symptoms, including angina, although concerns arise about his constant fatigue and deteriorating state. The patient has a history of smoking and drinking alcohol. These habits increase his risk for weight gain and heart problems. He works for an asbestos company and has been exposed to asbestos, which can cause a lung disease called asbestosis. Both of his parents had left-sided heart failure and type 2 diabetes. He currently takes 4 prescription medications for his condition and has no known drug allergies. Based on the focus assessment, it is clear the patient's blood pressure has spiked to abnormal levels at 152/88, while the respiratory rate is at 25 breaths per minute. The JVD is a sign of blood buildup in the heart, while the crackles indicate the presence of fluid in his air sacs. Both work in tandem to confirm the likelihood of right and left-sided heart failure. The lab test from August 15th also pointed at high BNP levels at 500, suggesting the presence of heart failure, while he also has low sodium levels at 132. His creatinine levels are set at 1.2, with mild elevation signifying impaired functioning of the renal system, likely due to decline in cardiac output. As such, the primary diagnosis is right-sided and left-sided congestive heart failure, although the professionals must consider the likelihood of COPD, renal failure, asbestosis, and pneumonia. The primary diagnosis necessitates completing a set of tests and diagnostics, which will help determine the extent of the damage. On one hand, ECG will highlight chamber enlargement, while the echocardiogram assesses the size, structure, and functioning of the heart. Similarly, blood tests are important in defining the heart muscle stretch and injury. The healthcare professionals must also develop a prescription plan containing diuretics to address the fluid buildup in the body, while beta blockers slow the heart rate. A follow-up plan will be used to manage a patient's weight and help them make the necessary lifestyle changes aimed to relieve the symptoms. Congestive heart failure is classified as a clinical symptom arising from functional or structural impairment of the heart. Regardless of the causes, the signs are presented during physical assessment, which help professionals determine the primary form. With left-sided congestive heart failure, it is common for patients to report blood backing up into the lungs and to the heart's inability to manage circulation. The consequent outcome is the occurrence of respiratory symptoms and fluid buildup due to the left ventricle being compromised. Relatively, right-sided congestive heart failure occurs when the right ventricle is weakened, thus inhibiting its ability to pump blood into the lungs. In turn, this leads to fluid and blood backing up into the body, thereby causing swelling in the legs and abdomen. A diachronic analysis of the guideline indicates the need for left ventricle ejection fraction assessment, which help assess the classify the heart failure into various categories. Furthermore, healthcare professionals can capitalize on non-invasive methods to identify diastolic dysfunction and natriuretic peptide levels, while also rely on catheterization to obtain hemodynamic measurements. The guideline also called for specialized testing where the professionals will use genetic sequencing, bone scintigraphy, and screening for serum to identify potential risk factors. The treatment guidelines emphasize the use of SGLT2 inhibitors, which are provided regardless of the patient's ejection fraction complemented by ARNIs. The ARNIs can only apply for patients with persistent symptoms while beta blocker like carvedilol and metoprolol also can reduce systematic vascular resistance and mortality. Apart from this, the patients can receive aldosterone antagonist in the case of any continuing symptoms impeding their quality of life. Based on the guideline, the treatment was appropriate since it applied the heart failure with reduced ejection fraction approach to improve the patient's outcome by reducing symptomatic overactivation and managing the neurohormonal pathway. Alternatively, the primary care provider can educate the patient on the importance of diet modification to alleviate risk and exposure. Here, the patient will be informed to consume diet rich in fruits and whole grains after limiting sodium intake. Likewise, the professionals will recommend supplements to address vitamins or nutrition deficiencies. If the damage is extensive, then surgical alternative can be provided to replace the affected organ. In some cases, congestive heart failure symptoms exacerbate the rise of concern about patients' risk of mortality. As such, the healthcare professionals will highlight primary symptoms that require urgent care. The patient will also learn how to manage the causes and prevent any factors that can undermine their outcome. And this brings my presentation to an end. Please review the certification questions on the next slide. Thank you.